The next most common sexual dysfunction is low libido or low desire. This is a very frustrating condition. And again, it's a very subjective definition. Some guys have a very low libido, they only want to have sex once a month. If it doesn't bother their partner, it's not a problem. Who cares how often you have sex? But what happens is a lot of guys used to have a lot of sex, used to enjoy a lot of sex, and suddenly they wake up one day and realize they're not having sex. They're not thinking about sex, and they're not enjoying sex. Very often, they have a partner who is frustrated with the lack of sex. Therefore, low libido and low desire, in this case, is a real problem. So what does low libido and low desire look like? It means guys are probably not having sex as often as they or their partner would like. They're probably not masturbating very often. And this ends up accompanying a sort of lethargy and lack of enjoyment in life and lack of physical intimacy. And lack of physical intimacy usually reflects a lack of emotional intimacy. Low libido and low desire often result in partners feeling isolated, lonely in a relationship, and without any resources or tools to improve things. What causes low libido? The most common culprit that comes to everyone's mind is low testosterone. Without testosterone, you simply don't have arousal, you don't have a libido, you don't have a sex drive. That's very common. Stress, anxiety, depression can cause low libido. Medications can cause low libido. Drug and alcohol abuse cause low libido. Illnesses, for example, cancer treatments, blood pressure treatments, diabetic treatments, they can all cause low libido. Not taking care of yourself is a really common culprit. You need sleep. You can't work all the time and expect to have a great sex life. You need to work, you need to play, you need to rest, you need to eat well, you need to take care of yourself. If you're burning yourself out, you're not going to be good for sex. Low libido can also be a symptom of a relationship issue, hidden resentment or anger with your partner, or lack of trust or lack of fun. You don't feel like connecting with them erotically or emotionally, it's going to result in low libido. And finally, this doesn't happen very often, but we can also uncover some sexual orientation issues. Guys discover somewhere through the life that they really aren't that attracted to women as much as they are to men. The result of this is just lack of interest in having sex with their wife or a girlfriend. This brings up the conversation of what they really want out of a sex life and who they want to have sex with. These can be difficult topics, but they're really important. Now, when it comes to treating low libido, things get complicated because this isn't like my arm isn't working or I can't bend my elbow and now I can, there it's fixed. With low libido, we're talking about feelings, we're talking about urges, we're talking about desires. This is pretty vague and shadowy stuff to be dealing with medication. Low testosterone is usually the top of everyone's list of where to start when it looks for what's wrong with libido. Low testosterone, this is a problem. There is this scale that doctors have. If you're somewhere between 300 and 1100, it's normal. Well, that isn't very helpful. That just means that somewhere in the world there's a guy walking around with a testosterone level of 300 and he's perfectly fine. It means he has a great libido, he has stamina, his body weight, everything's under control, and he's 300. But what we need to find out is what the best testosterone level is for you. The fact is, the vast majority of guys do function somewhere around 500 to 800 when it comes to testosterone. Again, this should all be discussed with your doctor. Here's a problem that we come across a lot. Doctors don't get training in testosterone replacement therapy. They want to be cautious, they don't want to be aggressive, they don't want to get in trouble, they don't want to cause problems. So a guy comes in saying, I have low libido, I'm tired all the time, I'm gaining weight, I have no interest in sex, I can't get erections, all that kind of stuff. They draw their blood and the testosterone is 350. The doctor says, you're above 300, you're perfectly normal, go away. The guy goes, I'm not normal. The problem is you need to find a doctor who specializes in testosterone replacement therapy. If your doctor doesn't want to give you testosterone, they may give you other drugs that can enhance testosterone levels. So doctors will give men Clomid as a way to get their testes in hyperdrive. Also, some guys use HCG, some guys use DHEA. All of these are things you work on and you talk about with your doctor.